Ikban to give us the highlight of what just played out. Mitari.
Yeah, thank you, Ruth. The Presidential Task Force on COVID-19 today listed various hazard allowances and incentives that will accrue to health workers who are in the front line in the fight against the coronavirus pandemic. One of such categories of the hazard allowance is that 50% of consolidated basic salary of health workers in federal government hospitals and medical centers will accrue to these health workers who are in the front line. And also the Presidential Task Force said it is going to dedicate all life insurance donations from the Nigerian insurance industry. All such life insurance donations will accrue and be dedicated to NYC volunteers in the health sector. And also, the Presidential Task Force says that 4 states, Cross River, Kogi, Nasarawa, and Yobe, are yet to record cases of COVID-19. The DG of the NCDC, however, said that testing will be intensified in such states so as to ascertain the true status of the states and appeal to authorities in these states not to hide cases of COVID-19 in a bid to have a clean bill of health. And again, the federal government is still very much concerned about the situation in Kano, and the PTF says a high-powered federal government delegation will be sent to the state to work with the state government and all the health authorities to be able to ascertain the issues of multiple deaths and mass burials which continue to occur in the state. And lastly, if I may just add, the PTF has also directed banks that in addition to all its skeletal services, it should immediately begin clearance of checks to customers as a way of mitigating the effect of the restriction order on Nigerians. Those are the highlights, Ruth.
Thank you very much, Mitari Ikban, for that. We'll definitely get a full package of what played out later on. Well, let's go to Kano and look at this report. Kano State Governor Abdullahi Umar Ganduje has directed the State Ministry of Health to carry out verbal autopsy of those who lost their lives to various strange ailment over the weekend. In a statement by the State Commissioner for Information, Mohammed Garba, said a combined team from the State Ministry of Health and the Nigeria Center for Disease Control have been drafted to 8 local government areas within the Kano Emirate Council to perform the autopsy exercise. Consequently, families and relatives of the dead will be visited so as to trace their medical history with a view to ascertain what really led to their deaths. The statement also said the State Ministry of Health is also working round the clock to ensure adequate availability of drugs for common ailments such as malaria, typhoid fever, meningitis, among others, stressing that the primary healthcare system has also been reactivated across the 44 local government areas to guarantee easy access to healthcare delivery, even as the battle with the dreaded COVID-19 continues. Garba, who called for calm, urged residents to continue to strictly adhere to the advice from health experts on how to avoid contracting the virus. Let's join our correspondent Fatima Sanusi Karaye, who is standing by in Kano to give us an update on recent deaths recorded in Kano. Okay, we can have Fatima right away, so let's take other reports. More people, especially the less privileged ones, have continued to receive support in form of palliatives from well-meaning groups as part of measures to complement government efforts to reduce the effect of the lockdown as a result of COVID-19. Beneficiaries of the latest gesture were drawn from satellite towns in Dawai, Kibiu, Utako, around Federal Capital Territory, Abuja. 3,000 people benefited and took home food items such as rice, beans, noodles and detergents. The donors also took them through the techniques of maintaining high hygiene during the lockdown. Okay, let's go to another report. The coronavirus pandemic is still a shock to the world, more so when there is yet no cure or vaccine. As government, scientists and health workers intensify measures to end COVID-19, it is pertinent to note that this is not the first time the world is fighting a common enemy of humanity. There have been pandemics in the past that kept citizens of many countries indoors, with millions of people battling for their lives. Thekla Wilkie will take us back in time.
Not too long ago, the exchange of a handshake was an expression of a bond which was a widespread culture in most societies. Ironically, this seemingly harmless social gesture, which dates back to centuries ago, could spell doom in today's reality. The reason is not far-fetched. The world seemed to have succumbed to new regulations that contradict age-long traditions. Clearly, self-isolation, quarantine and other presentations of COVID-19 have had their moment in time. Flipping back through the pages of history gives one a sense of how past pandemics have reshaped societies in profound ways, with millions of people paying the ultimate price. It begs the question of what the world will become after COVID-19. Scientists have known of the human coronavirus since the 1960s. The Middle East Respiratory Syndrome, MERS, and the Severe Acute Respiratory Syndrome, popularly known as SARS, all belong to the coronavirus family with similar symptoms to COVID-19. But the flu that the world will not forget in a hurry is the Spanish flu pandemic. The disease, which ravaged the world in 1918, reportedly killed more people than the First World War. With COVID-19 currently fanning its wings across the globe, this pandemic not only caught the world in a nightrobe, it is also redefining the elephant in the room. While some countries may recover, others may be on life support for a long time to come. For what is worth, the coronavirus pandemic have had most people pressing the reset button. While some are rebuilding their relationships, others are rethinking their priorities. Bottom line, the world may not remain the same, as COVID-19 has clearly moved the goalposts for mankind.
Again, in Lagos, if you recall, we joined him earlier. Dotun?
Ruth. It was after due consultation with health experts and policymakers on stringent measures to stop the spread of coronavirus in Lagos State that Governor Babajide Sanwo-Olu declared that residents must appear in public wearing face masks. Let's now join Adeola Komiyakere as she reports on the level of compliance on the takeoff day, Monday, 27th April.
Thank you, Studio. The wearing of face masks in public is now compulsory in order to interrupt the spread of the coronavirus in the current epicenter, which is Lagos. This is, however, not an excuse to violate the lockdown order currently in place, as Governor Sanwo-Olu kicks off Max Up Lagos. Already, residents who have to go out for one reason or the other wear face masks without qualms. As a matter of fact, it is becoming more or less a fashion statement, as we have seen even looking more dignified lately when he turns out in an assortment of diverse designs. Initially, a lot of people felt very uncomfortable wearing face masks because it gets in the way of inhaling and exhaling. However, with safety in mind, most people have become accustomed to the proactive cover and sometimes forget that they are wearing it.
Well, it's not affordable because of the coronavirus around the world. You have to protect yourself because they say prevention is better than cure.
If it is proven that with it life can go back to normal, if not at least a little bit normal, then I think it's the best thing to do.
I think that's what we need at this time. I mean, it's so necessary, especially when it's everywhere that coronavirus is airborne and it could stay on air for about 8 hours. So the best to do is to stay on this face mask.
Advise that wearing a face mask and social distancing are the surest strategies to stop the coronavirus pandemic. Studio is back to you.
Thank you, Adeola, and that's it from here. Nationwide continues after the break.
All right, let's go on a break. Thank you, Dotun. We'll be back shortly.
this time of despair, our country, Nigeria, needs us now more than ever. We stand a chance to save our great country, Nigeria. A chance to rise up from this pandemic stronger and better. What will be the gain if we do not learn from other countries and observe the lockdown to stop the further spread of the virus? If we loosen our guards and allow this virus doom our very existence, then what have we gained? This is the call to every Nigerian. Unite as one and stop the spread of this deadly virus. Stay at home and stay safe. Remember, the virus doesn't move unless we move. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
On Tuesday Live this week, COVID-19 community transmission and environment. How much has been done in this regard? Tune in to NTA Tuesday Live at 10:30 p.m. for answers and more. The program will be educative and incisive. Don't miss it.
It's time to take responsibility. So I'm staying home, watching videos and learning as well. We are all aware of the pandemic hitting the world today. The COVID-19 virus is real. A big thank you to all our health workers, doctors, nurses, everybody fighting this pandemic in their own way. Please stay home, save lives. Prevention is better than cure. Stay responsible.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 22 55 4272. This message is brought to you by ICPC and NTA.
The month of Ramadan is here again, and we at Al-Habibiyah Islamic Society once again call on all faithful to observe the physical and social distancing directive of the government to curb the spread of COVID-19. Always wash your hands with soap and water, use hand sanitizers and face masks when necessary, and stay at home. Observe your obligatory salat, tarawih, tahajjud, du'as, and askars with your families from the comfort of your home. Stay at home, stay safe, stop the spread of COVID-19. This message is from Al-Habibiyah Islamic Society, from Allah to you, a light.
We do appreciate you staying with us. Right now, we want to have a discussion on, of course, the coronavirus pandemic that everyone is battling with in the world. With me in the studio is former Special Advisor to the President on MDGs. That was when it was MDGs, Dr. Chris Otavo. Thank you very much for joining us.
Thank you for having me. Special Assistant.
Okay, Special Assistant, I beg your pardon. So now that reports have revealed that people who are mostly affected by this virus are people with underlying medical conditions. Now, what is their fate and what are your thoughts?
Well, anybody is susceptible to coronavirus, but when it happens in people who have pre-existing medical conditions, it becomes more serious and they are more likely to die from the disease than a healthy individual. So that's why it's more serious in the elderly, because the older one is, the higher the chances of having pre-existing medical conditions.
So is it a hopeless situation for them? Because already, they're down with other ailments. So what is their case?
It's not hopeless. It's not a hopeless situation in any way. As much as 95% of people who have the virus would survive it. And that's a large number. The problem is that we have a large number of people that could come down with the virus. And if you have a large number of people, let's say 1 million people getting the virus, 5% of that becomes a large number. That's 50,000. So So it's because of the high infectivity rates. That's why everybody is worried. Because at the end of the day, a small percentage would translate to a large number of people. Otherwise, majority of people would not even have serious symptoms, and a few would have serious symptoms and they will recover from it. Only a very small percentage would succumb to the virus.
Okay, and talking about symptoms, we know that the virus is playing a lot of tricks. We've seen new symptoms being discovered: loss of appetite, loss of taste, loss of smell. Yeah. What's your thought on that?
Yeah, the virus is a great mimicker, and that's the problem we're having with our healthcare system right now, because most of the people who end up in the isolation center following the diagnosis or the confirmation of their status would first of all present in private hospitals or other government hospitals, and unsuspecting healthcare providers would expose themselves to such people. And so that's the problem, because at first it will either appear like malaria or typhoid or upper respiratory tract infection or common flu. It might even present like community-acquired pneumonia. And so those symptoms are not specific to COVID-19. And so because of that, now hospitals are a little bit skeptical. They are reluctant to embrace patients. They are reluctant to take in patients for treatment. And that's why we need to be testing. If we can find a way of testing every single person that gets to any hospital before they get into the system to be treated, in order to avoid the healthcare providers from being exposed, that would be fantastic. And secondly, there must be provision of personal protective equipment, such that, because right now, for every practitioner in the country, the most important thing is to consider every person coming into the hospital to be positive, whether they have symptoms or not, because many COVID-19...
That's the presumption now.
Yes, and that's the safest thing to do, because many COVID-19 patients will not even present with symptoms.
But
some will present with weird symptoms, and so we have to protect the frontliners.
But doctor, before now, people get ill.
Yes.
With malaria, flu, pneumonia, and all that are similar to the symptoms of COVID-19. In the face of all these symptoms playing out and nobody's sure of what is actually wrong with them, some people may take to self-medication. What would you advise at this time, since hospitals are also being skeptical to admit?
Well, that's where the e-consultation comes in. Today, I've treated 2 people just by mere phone calls. I ask about symptoms and they tell me, and I tell them this is what you should take as a first line. If that's not working, then the people will have to come to the hospital. But in coming to the hospital must be prepared for them by putting on the personal protective equipment, by having the high index of suspicion. Because if we don't do this, the disease will clear the frontliners, which are the medical workers. And if the medical workers are decimated, the population is in a deep trouble.
Yes.
So because of that, yes, we agree that people, apart from COVID, people still fall ill. And that's why in the US, one of the first things President Trump did was to call a medical, what's it called, a ship, a hospital. And they called it from the sea, and a dock in New York, about 1,000-bed hospital. And that's where people who don't have COVID-19 were going to be treated, because you have to separate them from the general public. Yes. Otherwise, there will be crisis. Right now, people are dying because they cannot get optimum treatment. People who don't have COVID because of the scare. So we need to do something to save the general population while we try to fight this virus and chase it out of our environment.
All right, lastly, just before I let you go, it's a dicey situation, no doubt. What would you advise in terms of immunity boost for the elderly and also for the young?
Well, the most important thing that gives us immunity is healthy diet, a balanced diet that has all the necessary nutrients in it, and some people may have need for multivitamins and other extra. But then exercises, we have to do exercise regularly and have enough rest, avoid stress. If we do that, we will maintain our immunity at the optimum.
What about face masks?
Face mask is important. Now, the country is tending now towards the use of face mask everywhere you go. We are going to hear the president speak tonight. We don't know what he will say, but I expect that if at all there's going to be a reduction, a loosening of the lockdown, then people must have to use face mask as long as they are outside. Some countries have made it a policy now. If you are found outside without a face mask, you'll be arrested. So face mask and the normal hygiene of washing hands and coughing into the elbow, they are still very relevant at this time.
Thank you very much, Dr. Chris Otawa. I hope you have your face mask as you walk out.
It's with me. We have a good distance. That's why I'm not wearing it.
All right. Thank you so much. He's the former special assistant to the president on MDGs. Let's look at more issues. COVID-19, the need to strengthen primary health facilities in local government areas as part of efforts to mitigate the spread of coronavirus has been re-echoed on NTA's Good Morning Nigeria. The guests who were speaking on the topic, COVID-19, the role of local government, are optimistic that engaging government at all local level will record more success in the fight because of their proximity to people in the grassroots. Lydia Sampson has that report.
Since the announcement of lockdown and other measures to curtail the spread of COVID-19, some local government areas have embarked on sensitization through traditional rulers to have the buy-in of the people. Unfortunately, there are still pockets of people not adhering to the stay-at-home directive or keeping to the social distance protocol. These key players say remain a great concern.
Our people are difficult to deal with, sincerely. Even at the point of these serious situations, the people refuse to get sensitized, sincerely. I'm just coming to the town now from the village. You need to see the collection of people gathering in one same place. And you begin to wonder, have these people not been sensitized? Have the government not sent message to the people? Please keep off the street.
However, the local government say they can and are ready to do more, but for lack of funds.
From statistics available, almost 20-25% of the cases are those who do not even travel at all, which means that there's been transmission on person-to-person basis, and for that reason, even like the case we have in some states, people has even left the city center into their villages before they did some contact tracing to get them.
They lamented what they call the undermining of local governments, which they say led to the gaps in primary healthcare facilities at the grassroots level.
Building infrastructures, primary healthcare, day in, day out, whether there is a COVID outbreak or any, because nobody knows what outbreak is likely to come again. The healthcare delivery systems should be improved so that whatever comes up, local governments will be able to adequately, address it.
The guests are unanimous that the major lesson from COVID-19 is the need for provision of more health care infrastructure across the country to serve even beyond this pandemic. In Abuja, Lydia Sampson, NTA News.
And joining me now from Ibadan studio, let's talk about flooding, is Urban Flood Management Project Coordinator, Mr. Adebayo Ayorinde, who is set to shed more light on government's effort at managing flood in Ibadan, considering the fact that the rains are here, and flooding has been identified as one of the major problems of the state. Thank you very much for joining us, Mr. Ayorinde. Can you hear me?
I can hear you.
Now, Ibadan, or your state is one of the states that is often faced with flooding year in, year out. What's your take on this incessant flooding experience in the state?
Ibadan is the capital of your state. And it has, in the past, had a share of flood incidents. And the state government, due to the flood incidents of the year 2011, where lives were lost and properties destroyed, put in place a project with the assistance from the World Bank called the Adamawa Flood Management Project to comprehensively address the flooding problem in Ibadan City. And under that project, we have seen so many measures put in place. We have 3 master plans that were prepared for the city: the Ibadan City Master Plan, the Drainage Master Plan, and the Solid Waste Management Master Plan. These are with a view to preparing grant for
Okay, we seem to have lost the audio from Ibadan. Okay, he's back. I hear he's back, so let him continue. Mr. Ayorinde, if you can hear me, go ahead. Let's go ahead with the next question. Now, we know that from the state and federal level, there have been measures put in place to mitigate flooding. But this year, this time around, what has been done differently by the state government, talking about Oyo State, to help protect the people against flooding?
Yes, this year, the state government has approved 2 key projects to channelize the flood-prone rivers in Ibadan. These rivers include Ogbere River, Kudeti River, Orogun, and Agodi River. All these are going to start in harness in the course of the year. The contract has been awarded. And equally, there are palliatives that are going to be implemented in terms of dredging across almost 36 rivers and major drainages desilted, just to make sure that we don't have flooding in the city of Ibadan. So these have been identified by the Ministry of Environment, and in the course of the coming months, these dredgings will begin to take place, so that we will have our rivers and drainage channels desilted, so that there will be opportunity for the runoff of flood water to go without flooding houses and properties within the city, and livelihoods of people will be protected. So that is the essence of what the state government has been putting in place under the Adamawa Flood Management Project.
All right, Mr. Ayorinde, it takes 2 to know out what has been in place in terms of sensitization to persons who live in flood-prone areas, because the floods are inevitable.
Apart from this physical intervention by the state government, there have been awareness creation. We have various programs, sensitization programs, jingles, and various means of sensitizing the people in forms of drama and other programs on radios. And these have been part of what we are doing in the Adamawa Flood Management Project as part of non-structural programs. We have reached out to communities. We have engaged them in various sensitization programs, and these have been ongoing at various communities. Mostly, the important thing that we have discovered is that this issue of solid waste disposal has been a major problem. So we have sensitized people to dispose their waste rightly, and we have engaged the members of the public with various programs, with our partnering with the Ministry of Environment to reach various communities on how to dispose their waste rightly, and to make sure that they do not end up dropping their waste in drainage channels, because these are major contributory factors to the issue of flooding. And so there have been various sensitization programs that are ongoing in the state and at our own project level.
Thank you very much, Mr. Adebayo Ayorinde. He's the Urban Flood Management Project Coordinator. Thank you very much.
Thank you very much.
Okay, so just like we try to battle COVID-19, try to curtail the spread, let's also try to mitigate the spread of let's try to mitigate flooding in Nigeria. But talking about COVID-19, the Director General of the National Institute for Legislative and Democratic Studies, Professor Abubakar Suleiman, has set up a technical committee of experts on COVID-19 to develop legislative and policy proposals for consideration of the National Assembly. In a statement, Professor Suleiman notes that these steps becomes imperative to assist the Nigerian government develop a robust exit strategy that outlines steps needed to be taken to reopen the nation's economy and health towards curtailing a resurgence of COVID-19. The committee, which includes economists, political scientists and medical experts, will also produce a legislative framework for consideration by the National Assembly upon resumption. In a related development, Professor Suleiman has also commissioned a study to, among others, examine the relationship between pandemics and political economy and highlight short and long-term measures to avert this and future crises. The coronavirus crisis has raised important questions on how worsening economic crisis is intertwined with pandemics. It has also exposed the daunting deficiencies of public health systems and threats to industries, supply chains and stock markets. Contributors to this study will include experts, practitioners, policymakers and academics from all sectors. Findings from the study will be presented to the leadership of the National Assembly in August 2020. In a related development, the House of Representatives is set to reconvene plenary on Tuesday, that is the 28th of April 2020. A statement from the House Clerk, Patrick Giwa, indicates that guidelines approved by the federal government and the Center for Disease Control, including additional guidelines developed by the House, will be communicated to members. The statement, however, directed staff and members' aides to work from home, as they will be notified when they are needed in the office for any special assignment. Let's go to Part2 to join Dibabari. Let's find out what's happening there. Dibabari.
Thank you, Ruth, and welcome to Part2. Due to its extensive borderline with Cameroon, the governor of Cross River State, Ben Ayade, is appealing for support from the federal government to prevent the entry of COVID-19 into the state from that axis. Paul Abel reports that the governor stated this while addressing newsmen in Calabar.
Governor Ayade says he is addressing the COVID-19 problem from a peculiar perspective, with technical strategy of food for the old and jobs for the young, as well as policing its international borders, covering 10 local government areas of the state.
I plead with the federal government that please allow us to address our problem in our own way. We need to close our borders, support us to close our borders, support us to keep the borders closed until such a time that the whole world agrees that it is safe.
The governor says it has granted the request of the federal government to relax its lockout to those on essential duties like petroleum workers, food transporters, journalists, among others. However, he emphasizes that these categories of persons must undergo strict screening before being allowed into the state and escorted out when they intend to leave the state. In Calabar, Paul Abel, NTA News.
The baby whale and fishes washed ashore at Agaja County in Finimatan, Boni Local Government Council of Rivers State may appear like manna from heaven at this time. Environmental health experts say its consumption is a disaster waiting to happen. Robinson Dertide has the details.
The sperm whale is believed to have died weeks ago and has started decomposing from its tail. But residents ignored warning on the health hazard and have continued to feast on the mammal, which is speculated to have died as a result of chemical pollution of the Atlantic Ocean.
It is hazard of a multi-nature, Consumption of it is a problem. Having it around even if it's not properly disposed of, it's also a problem.
I know that the oxygen in the sea has been deoxygenated, and so that is the cause of the dead fish now. And what recently happened about the dead whales.
Samples from some of the dead fishes have been taken for laboratory tests, while environmentalists urge government to launch satellite imagery investigation on the ocean.
This is the time to leverage all the stakeholders, the companies working around there to come together to say, hey man, let's find out this. At least to forestall future occurrence, at least to remedy the situation, at least to clean up the environment.
This particular species of whale, sperm whale, is no longer in abundance. So for us, wildlife is a very, very big blow to the conservation efforts that one is trying to put in place.
The bones of the whale has been evacuated to the Finima Nature Park for future reference. National Environmental Standards and Regulations Enforcement Agency declined comment pending the conclusion of laboratory investigations. In Robinson Deratede, NTA News.
And that does it from Port Harcourt. Nationwide continues right after the break. Good evening.
Mary, thank you. We're not going on any break yet. Let's look at more reports to complement the efforts of the federal government towards providing palliatives to the most vulnerable in the society. The Rotary Club District 9125 have donated food items to 1,000 households in Gwagwa Karimo, a suburb of the FCT. Do India reports that the donation was supervised by officials of Abuja Municipal Area Council. Okay, we seem to not have audio in that report, but we'll bring it in our subsequent bulletin. Let's join Abubakar in Maiduguri for more Nationwide. Abubakar.
We're glad you've joined us. The National Emergency Management Agency, NEMA, has emphasized the need for proactive steps towards ensuring that internally displaced persons in Borno are protected from contracting the deadly coronavirus pandemic, considering their vulnerability. Director General NEMA, Mustafa Yunusa Mehaja, stated this in a message during a one-day sensitization workshop on COVID-19 for camp managers, IDPs leaders, and health workers operating in camps within Maiduguri. The report. The one-day sensitization workshop, basically for camp managers, leaders of IDPs and health workers operating in camps, is aimed to take the message of the ongoing campaigns to their various places against the deadly coronavirus pandemic. Declaring the workshop open, Northeast Zonal Coordinator NEMA, Saidu Ahmed Minin, said the sensitization program is in line with the agency's core mandate of emergency prevention, and therefore charged the participants to make sure they reflect every aspect of the event to the target beneficiaries, especially in terms of taking precautionary measures.
I'm expecting the participants to go back to their respective camps and step down this training. That is to impact the knowledge and skills gained from this workshop to other IDPs that are not privileged to be here.
Using a PowerPoint medium, Director, Disease Control, Borno State Primary Healthcare Development Agency, Dr. Babagana Abisu, traced the history of COVID-19, its devastating effects, and how best to fight the pandemic, while commending NEMA for its renewed determination in ensuring the safety of IDPs. The participants described the workshop as timely in view of the level of ignorance among victims of insurgency and assured to step down the knowledge acquired. Towards complementing efforts of Borno State government on awareness creation and hygiene measures for prevention of spread of COVID-19, the Nigeria Union of Local Government Employees has engaged in activities aimed at halting community spread, especially in IDPs camps. The labor union also presented hand-washing facilities to IDPs camps and strategic locations across the state. Muhammad Ibrahim reports.
The hand-washing facilities presentation led by Malgwe State President Comrade Mustafa Bulang Magumeri and other members of the union was done at some areas within the metropolis to include Shetima Alimu Minotishak Village IDP Camp, Suber and Musa Osman Secretariat. Presenting the places visited, Malgwe President Comrade Mustafa Bulang Magumeri said it is part of social responsibility to complement effort of the state governor to curb community spread of coronavirus disease. He said it is necessary for the union to take part in the sensitization campaign to ensure that people are enlightened on ways of preventing COVID-19 pandemic in addition to observing personal and environmental hygiene.
We suppose the government in complementing this good effort of the federal and our state government in order to sensitize our people.
Comrade Mustafa Bulama demonstrated proper hand washing and called on people to imbibe the culture of social distancing and washing of hands with soap and water and use of hand sanitizers regularly to protect themselves from contracting the disease. Chairman Sugat Dr. Shetima Bukatulima, Chairman Local Government Service Commission, Senator Kakama Dumiale, Permanent Secretary Local Government and Emirate Affairs, Tarka Asaria, and MMC Secretary Governor Shetima commended efforts of Nolgate members for providing hand-washing facilities and promised to make good use of the items. In Maiduguri, Muhammad Ibrahim, NTA News.
We're on to Nationwide on the Nigerian Television Authority. Let's now return to Ruth in Abuja to enjoy the rest of the evening.
Thank you, Abubakar. The Adamawa State Command of the Immigration Service says despite the porous nature of the state's borders with Cameroon, it remains alive in ensuring both legal and illegal routes are properly sealed to prevent any possibility of importing coronavirus and other unwholesome activities into the country. Bilkisu Abubakar will tell us more.
Adamawa is one among the states that shares border with Cameroon Republic, which has different routes into the state, thereby making it porous, as almost all the local governments has a foot passage into the state. This remains the contributing factor for smuggling, illegal entry, and other unwholesome activities that may lead Nigeria into some challenges. Just recently, packs of diazepam drugs, which has not even registered in Nigeria, have been confiscated from a Cameroonian who has the intention to sell it in Adamawa. Already, the Immigration Service, National Agency for Food, Drug Administration and Control, and National Drug Law Enforcement Agency have concluded investigation to ascertain the health status of the suspect and repatriated him back to Cameroon to avoid the escalation of coronavirus in Nigeria.
If not for the resilience of the patrol we have been doing, this Cameroonian will have find his way to this country with these drugs.
The Adamawa State Command of the Immigration Service has intensified patrol in all the borders so as to ensure Adamawa is free from any sharp practices. In Yola, Bilkisu Abubakar, NTA News.
And that's Nationwide. Thanks for staying with us. I'm Ruth Aguale. Bye.